Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about the signs that we see in carotid body tumor. And we have two signs over here. One is the Fontaine sign and then we have the Lyre sign, which we all know about. We'll discuss about what kind of a sign is this, where do you see it, what is the reason behind seeing it, why is it named so. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign. Now, our first sign over here is the Fontaine sign. Now, what is this Fontaine sign? Fontaine sign is actually a clinical sign that we elicit when we palpate a neck swelling. What is it exactly? Here, when there is a carotid body tumor, you'll see when you try to palpate the carotid body tumor, you will be able to move it from side to side. But you will not be able to move it from up and down in the vertical direction. So we have horizontal mobility here, but the vertical mobility is restricted. This is typical of a carotid body tumor. Now, why does this happen? So, as you can see in the image, the carotid body tumor is actually fixed at the carotid bifurcation. It grows in between the internal and the external carotid artery. Because of that, we are able to do this lateral movement because there are loose tissue planes. But since it is anchored between the internal and external carotid artery, we cannot do a vertical movement. And this sign is an eponym. This was named after Fontaine, who was the one who described this characteristic mobility pattern in carotid body tumors. So that's about the Fontaine sign. The next sign is the Lyre sign. Now, Lyre sign is a very typical sign that we see associated with a carotid body tumor. Now, Lyre sign is actually a radiological sign that we usually see on angiography. What is this sign? If you look at the image over here, we can see that there is a splaying or separation of the internal carotid artery and the external carotid arteries at the carotid bifurcation. And this is a typical feature of carotid body tumor. Now, what is a carotid body tumor? The carotid body tumor is a tumor which is arising from paraganglionic tissue at the carotid bifurcation. So, as it keeps, because it has arisen from the bifurcation, it grows in between the internal and the external carotid artery. And because of that, it ends up causing a widening or the splaying of the carotid artery, splaying of both the carotid arteries. You can see in the image over here as well that this is a carotid bifurcation, and you can see how the two carotid arteries have been splayed. This is called the Lyre sign because do you know what a lyre is actually? That's something I found out very recently. Lyre is actually a classical string instrument. I've attached an image here, which is in the shape of this U-shaped instrument that is seen in classical music. And this sign represents this instrument. You can see how similar they look like. That is why this has been called as the Lyre sign. Another important MCQ related or a viva related question that you should remember here is there is also something called a pseudo Lyre sign. So a true Lyre sign is seen in a carotid body tumor, and carotid body tumors, as we all know, is a very highly vascular tumor which has an intense tumor blush, whereas pseudo Lyre sign is seen in nerve sheath tumors like schwannomas or the neurofibromas, which arise from cervical sympathetic chain or the vagus nerve. And these tumors are not vascular at all. They just mimic this splaying behavior, but they are actually not a vascular tumor. So therefore, what is our takeaway over here? That whenever you see this kind of carotid splaying happening, do not assume that all carotid splaying is equal to carotid body tumor. That's not the case. When you see the splaying, you should always assess its vascularity and the origin of the tumor first before making any further plans. It could very well end up being a nerve sheath tumor like a schwannoma or a neurofibroma, which is absolutely not vascular at all. So this is about the two signs that we see in carotid body tumor. I hope you have easily understood it. And if you have any doubts regarding this, you can note them down in the comment section and I'll get back to you. Thank you.